3. Today marked Georgia's 5th highest day on record for new confirmed COVID-19 cases. The state recorded and reported about 4,300 cases today. And the coronavirus in Georgia and how it's impacting you is our top story tonight. And we're taking a look at the big picture to put everything into perspective for you folks. And it shows a mixed forecast of great news and terrible news, in the words of Dr. Harry Heiman of Georgia State University's School of Public Health. Now, he spoke with Jon Shirek on what to expect in the months to come. John.
Dr. Harry Heiman of Georgia State says if nothing changes, if public health mandates stay as they've been, and if the public continues to do what we've all been doing as a whole, then the worst and the best are ahead for us all.
We're kind of in this odd space of great news and terrible news. The great news is that at a faster pace than anticipated, we're going to be rolling out vaccines. I think the other side, though, is that we are at probably the most dangerous point in the pandemic in terms of the rate of rise of cases, numbers of hospitalizations. In Georgia alone, we have 20 major medical centers that are on diversion, meaning that they either don't have medical beds or don't have critical care beds. And we're just seeing the early part of this next rise.
Yet there are nurses and doctors who, as Georgia Governor Brian Kemp heard at a hospital meeting on Wednesday, are reluctant to get the vaccine because it was rushed in development. Dr. Heiman believes they will ultimately trust that it's safe as long as the FDA does not rush the approval process and as long as everyone is able to see the manufacturer's detailed research data.
It's also my expectations that hospital systems will probably require mandatory vaccination in order to protect its healthcare workers.
The vaccine's expected to be on the order of 90% effective, meaning they will likely protect 90 out of 100 people. But
I can't even answer the question of, is vaccine protection good for 6 months? We don't know that.
Even so, Dr. Heiman believes the pandemic will likely end within 6 months. As the vaccines become part of our lives instead of the virus, it's just getting there that will be, he says, the toughest part of the pandemic.
Both our cases and our hospitalization rates have gone up 20% in the past 2 weeks. And I'm concerned that that's going to continue to rise. We're really at the most dangerous point in the pandemic so far.
And we're hearing the same warning this week from the CDC director. The advice, it's more important than ever to be more diligent than ever with all the safety precautions.
Yeah, really good advice there, John. Thank you. Tonight.